First on WCCO, our Erin Hassanzadeh sits down with outgoing Minnesota Department of Health Commissioner Jan Malcolm. She is retiring next month after decades of public service, including the past few years helping to steer the state through a global pandemic.
Erin now shows us what that COVID experience looked like through Malcolm's eyes, and the work, she says, still lies ahead.
When COVID-19 hit, Jan Malcolm was no stranger to being at the helm.
My first time here as health commissioner was back in 1999 with Governor Ventura. It
wasn't her first time dealing with a crisis.
We had 9/11, and that was a major trauma, obviously. And that brought with it all kinds of immediate responses around things like security and bioterrorism.
Still, nothing could have prepared her for the monsoon that would crash in at the start of the decade.
It was March 6th that we had our first confirmed case here.
Was there actually a plan, and what was the extent of our contingency plan for this worst case scenario?
We have had for years plans of various sorts for different kinds of emergencies. So we had to take those plans that were built for shorter term events and try to figure out how do we keep it going. But the problem is we never knew how long it was going to have to keep going.
She also wasn't prepared for the skepticism that would follow surrounding vaccines, masks, and restrictions.
I'm sure some people weren't happy with you guys, and you heard
for sure.
about that. How did you deal with that even at the human-to-human level?
I mean, it's kind of hard to get your head around why people who are just trying to help other people would suddenly become kind of perceived as villains of some sort. It's really painful. But I think, unfortunately, this became kind of ideological and political.
At some point as a community, we were asked to take care of each other. You talked about that a lot. How do you think we did with that assignment?
Well, I think we did quite well early on, even though there was always a negative consequence to the closures, for instance, of businesses and kids being in remote learning. But early on, I think there was more understanding that we're kind of all in this together. I think we struggled with it at many, many levels, certainly in our communities, in our families, as a state, as a country, and all over the world, we're seeing similar fatigue.
She thinks that fatigue could be why we're in the midst of a bad season for all types of viruses.
We've got great tools now to manage it, but we have to use the tools, vaccinations, treatments, and some of those basic prevention strategies that have helped us avoid what we're seeing right now, a bad flu season.
How do you think that the pandemic changed us?
I hope it taught us some valuable lessons, but I think it also put a lot of stress on us and made us realize that we're not automatically as connected as we thought we were and need to be.
In St. Paul, Erin Hassanzadeh, WCCO 4 News.
Tonight at 10, more of Erin's conversation with Jan Malcolm. They'll discuss the current state of our healthcare system and what we can all do to keep each other healthy.